Your beautiful baby boy or baby girl is now 26 years old and they got to be kicked out of your family's group health insurance. But what are you going to do? You're the parent and your child doesn't know anything about health insurance. Heck, I didn't even know what a deductible was until I was 30. But where do you go to shop for a health insurance plan for your child that just turned 26 that is getting kicked out? You can either go to the Obamacare market, but there's also a non-Obamacare market. The Obamacare market is typically going to be more expensive, whereas the non-Obamacare market is going to be more affordable and lower deductibles. In this video, I'm going to go over the main differences between both markets. But concept-wise, the ACA market, known as the Affordable Care Act, or Obamacare, or major medical individual market, GetCoveredIllinois.gov, Healthcare.gov, PPACA, which stands for this long-ass acronym, they all mean the same darn thing. You can only buy these plans during open enrollment, which is typically between November 1st through December 15th. Sometimes it carries on until January 15th of the following year. It covers 5 key benefits, and that's why it's so expensive, because it covers free preventive wellness, covers maternity, covers mental health like depression, anxiety, ADHD, marital therapy, covers prescriptions, all 4 tiers, from tier 1 generic to tier 2 brand to tier 3 non-preferred brand, and tier 4 specialty drugs, covers pre-existing conditions. You could be on a waiting list for a $1.6 million liver transplant, and you have access to a health insurance plan, so long as you have a triggering qualifying life event like one of these. Whether you lost group health insurance, you moved, got married, got out of jail, had a baby, adopted a child, as long as you have any of these qualifying life events, you will be qualified to purchase an ACA major medical plan or Obamacare plan. It's going to be expensive. And the reason for that, like I mentioned before, is that you're in a pool of people that have a lot of pre-existing conditions, currently pregnant, or at a lower income. And so health insurance carriers, they're in it to win it. They're not going to want to spend out as much medical claims as possible. They'd rather collect premiums over paying out medical claims. That is why in the, let's say, 6067 zip code, let's say, yes, I'd like to see if I qualify, if my son or daughter qualifies for a subsidy. They're 26 years of age. Chances are you're going to be shopping for a health insurance plan for your child because they don't really care about health insurance at age 26. So they're making an income of $55K a year just themselves. They don't file as a household of 2 on their taxes because they have no kids, no dependents, no spouse just quite yet. So $55K. Income is too high. Income is too high for any monthly subsidies. And let's say they're losing health insurance because they're aging out at age 26. Skip this step, skip this step. Starting price tag for a 26-year-old in the Chicagoland area of 60607 is going to be about $300 a month with a $9,000 deductible. These are all the health insurance carriers available. Not all health insurance carriers are going to be available based on the residential zip code that you file your taxes in. Out of all these networks, PPO is going to be the most supreme because you'll have access to the most doctors and hospitals. Plus, they get paid better when they see the words PPO. And you're going to observe that out of all these health insurance carriers in the Chicagoland area, Blue Cross Blue Shield of Illinois is the only one that's offering options. And the starting price tag for a PPO is going to be $532 for an $8,600 deductible. If your son or daughter that is 26 years of age is healthy enough, they can qualify for a non-Obamacare plan, or in other words, a Workers Association group health plan. It's group health insurance because they're going to be employed by research companies that are going to require them to do monthly survey/assessments that require a minimum of 15 minutes a month doing an assessment. In exchange for doing these monthly assessments, these research companies are going to compensate your child with a $40 per hour wage. You don't necessarily have to do an hour. The minimum is 15 minutes a month to do these monthly assessments. So just get paid the $10 and be done with it as long as you're able to maintain a group health insurance plan. But skip to the actual pricing of it all. Instead of paying $533 for an $8,600 deductible, your child could be paying only $267 for a $1,500 deductible, and it can even have $50 copays. Whereas this $8,600 deductible doesn't have any copays. You're paying full price whenever your child is sick. A PCP will charge anywhere from $200 to $300 these days. A specialist will charge anywhere from $300 to $800 because they went to medical school longer. And so they feel more self-entitled to be charging more. Preventive care is no charge, but that's the same thing with this particular plan. there are limitations for this type of non-Obamacare plan. VL stands for visit limitations, meaning to say that your child is capped at 10 visits per calendar year when it comes to seeing a specialist. And then when it comes to emergency rooms, they're capped at 4 ER visits. 2 of them are accident and 2 of them are sickness related. So that means that your child, your 26-year-old, can have a maximum of 4 ER visits to the ER room. And the most that they'll be covered for accidents will be 2 times. And the most they'll be covered for sickness is also 2 times. For a 5th ER visit, it's going to be out of pocket. That is why this quote is so much more affordable at $267 a month versus the unlimited visits to the ER for $532 a month. But the thing is, you have to pay for the first $8,600 deductible when you want to go to the emergency room. Everything you're paying full price straight down the line. Full price for x-rays, CT, PET, MRI, blood work, full price for medications, unless it's just a generic where you just pay $25. So if your child just turned 26, they're not just subject to the Obamacare market. They have access to the Workers Association group market. The thing is, though, you're going to have to just get in touch with a local health insurance agent. Or you can get in touch with me. My email is below, or you can just shoot me a DM. And then I can shop around for you and go over the pros and cons as far as benefits and exclusions goes. So if you ever have questions on your medical bills, as far as like, what does this mean? Or how come I got charged this much? Watch this video right over here.